Healthcare service provider Cano Health outperforming the broader healthcare sector in September, posting a 7% gain for the month. But shares of the company have been under pressure since going public in June via a SPAC backed by real estate investor Barry Sternlicht, with the stock down around about 14%. Let's bring in Contessa Brewer, who joins us along with Cano Health CEO Dr. Marlo Hernandez from the Latitude Conference in San Diego, California. Contessa, over to you.
Wilfred, thank you for that very much. And Dr. Hernandez, great to see you today. Can you talk a little bit about Cano Health and the way it has disrupted the model of delivering health care?
Sure. Well, first, thank you for the opportunity. It's such a great honor to be here with you. But yeah, Cano Health, I term it the most exciting company on the planet. Probably not too surprised to hear from me, as it's been a 12-year labor of love and just my professional purpose in life. How Cano Health is disrupting healthcare is because our patients are measurably getting better care. We're a primary care provider, 8 states, 110 plus medical centers, 1,000 plus affiliated providers, but measurably better care, as we have done during COVID with a 60% lower mortality.
Well, how are you doing that?
How are we doing that? Well, we are removing the barriers that patients have to getting quality health care. Access, for example, we give them transportation, 24/7 urgency line, telehealth. We do better quality. We'll do better preventive screenings. We have all these wellness programs. It's all designed so that we can measurably lead a better life, a longer life for our patients while taking costs out of the system. And that's the important caveat that every market needs, that the country needs.
Is this really an argument about better efficiency in delivery, or are there other factors there? Have you innovated in ways that allows you to deliver better results?
You know, that's a great question. We're certainly tech-enabled. We have this population health platform that underpins everything that we do, that wraps around the clinical delivery. You don't need to change evidence-based medicine. I'm a physician, practiced 10 years. What you do need is you have to enable clinicians to be more effective, to focus on their patients, to make sure that that patient actually gets the diagnostic study, that you address social determinants of health, that you have all these services like cardiovascular prevention, like physiotherapy, as part of primary care without charging $1 more. And when you do that, when you invest more in primary care, you decrease a lot of that wasteful, low-quality spending that happens when you have all these complications on diagnosed conditions. And that's how we're able to get a 20% cost reduction while we're measurably better, 20+% on quality ratings and 60% lower mortality rate among our patients that are, let me tell you, mostly Latinos, African Americans, so socially underserved. They're older, they're poor, they're sicker, and yet we're getting these better results because we have this technology, but also a model of care that it's just absolutely necessary for our country.
Dr. Hernandez, it's Sarah. I wanted to ask you about a hot topic in the news, which, of course, is the vaccine mandates for healthcare workers, and whether it's something that you had to undertake as part of President Biden's order for healthcare companies that accept Medicaid and Medicare, and whether it's making it trickier to find those healthcare workers as we're hearing about so many shortages and so much tension as a result of these mandates. What are you seeing?
Yeah, well, obviously, I am a big proponent of the COVID-19 vaccine and all vaccines. They're truly a public health miracle and is the reason why we made such great advancements during the 20th century. At the same time, we, at the end of July, instituted a vaccine or weekly testing mandate. And that was a bit controversial at the end of July. It has protected our staff, has protected our patients. We have well over 87, 88% of our staff and patients vaccinated. I don't believe that you must mandate it for medical, religious, and other reasons, but you should definitely have a mandate or a weekly testing in order to keep your staff and providers safe. It doesn't affect us yet, but if OSHA and other federal guidelines do change and would force us to do it, then we'll, of course, comply. I just don't think that's the right course.